Hello, this is Akram Jafar, and in this session, I'm going to deal with the lymphatic drainage of the head and neck. This is the general plan of the lymphatic drainage of the head and neck. All lymphatics of the head and neck drain to deep cervical nodes. And from the deep cervical nodes, efferents will form the jugular lymph trunk. And the jugular lymph trunk either joins the thoracic duct on the left side, as we can see here, or it will join the right lymph duct on the right side, together, of course, with the subclavian and the bronchomediastinal lymph trunks. So all lymphatics of the head and neck, they will drain to a deep cervical lymph nodes that will drain to a jugular lymph trunk. Now, lymph nodes are either superficial or deep. So the superficial cervical nodes lie along the external jugular vein. This is the external jugular vein, which is located superficial to the sternocleidomastoid muscle. In addition to these lymph nodes along the external jugular vein, there are few lymph nodes that are located in the anterior triangle of the neck along the anterior jugular veins, and these, both of them, send lymphatics to the deep cervical lymph nodes. This is to show you a patient with an enlarged superficial cervical node. The lymph node is located on the superficial surface of the sternocleidomastoid muscle. So from these superficial cervical nodes, which can be palpable, to deep cervical lymph nodes, which can also be palpable here in the neck. These deep cervical lymph nodes, they lie along the internal jugular vein, which is a deep vein. As the common situation elsewhere in the body, superficial lymphatics follow the superficial veins, deep lymphatics follow the deep veins. The deep cervical lymph nodes drain lymph filtered through outlying nodes that are arranged in two circles here. These are the two circles. So there is an outer circle, horizontal superficial ring, also called outer circle, and an inner circle, which is horizontal deep ring. The horizontal superficial ring is made up of nodes from the chin to the occiput. From the chin to the occiput. We are going to study them in detail in a moment, while the inner circle surrounds the upper air and alimentary passages. So it is surrounding the pharynx, the larynx, and the upper part of the trachea and esophagus. Now let's deal with the deep cervical lymph nodes. The deep cervical lymph nodes are subdivided into an upper and a lower group. Look at this. This is the internal jugular vein. This is the common carotid artery, and lateral to it is the internal jugular vein. And these deep cervical lymph nodes are located along the deep vein, the internal jugular vein, and they are in an upper group and a lower group. Let's start with the upper group of deep cervical lymph nodes. The upper group is located in the angle here, which is located between the lower border of the mandible and the sternocleidomastoid muscle. One of them, one special one here, like this one, is related to the posterior belly of the digastric. This is the digastric muscle with two bellies. So this is the posterior belly of the digastric. This lymph node, therefore, is called the Jugulo-Digastric node. This lymph node is specifically involved in infections of the tonsils and is therefore called the tonsillar node. So the other name of this lymph node, of the Jugulo-Digastric node, is the tonsillar node. You can see it here. This is an enlarged Jugulo-Digastric or tonsillar lymph node located in the angle between the lower border of the mandible, the sternocleidomastoid, and this is the way of examining the upper deep cervical lymph nodes in general. So as I said, they are divided into an upper group and a lower group. The lower group of deep cervical lymph node is situated in the angle between the sternocleidomastoid and the clavicle. See here, they are represented, the boundaries are represented by the letter Z. So the upper group in this angle and the lower group in this angle. Like the upper group, there is one which is special. There is also one which is special for the lower group of deep cervical nodes, and it is located where Omohyoid crosses the internal jugular vein, close to its intermediate tendon. This is the omohyoid muscle, one of the infrahyoid muscles. It has a superior belly, intermediate tendon, and inferior belly, omo, because it's attached to the scapula. You can see that it extends between the hyoid bone and then goes to the upper border of the scapula. Jugulo-Omohyoid, because of its relation to the omohyoid. Also, it has another name. It's called the lingual nodes, because it receives ultimately all the lymphatic drainage from the tongue and is therefore called the lingual nodes. Another member of lower group of deep cervical nodes are called the supraclavicular nodes. They lie in the posterior triangle. The other members of the group, they lie deep to the sternocleidomastoid muscle. So they lie deep to the sternocleidomastoid. But the supraclavicular lymph nodes lie in the posterior triangle of the neck, the triangle that is located behind the posterior border of the sternocleidomastoid, between this muscle, trapezius, and the clavicle. So that is called the posterior triangle. The efferents from the infraclavicular lymph nodes and from the deep cervical lymph nodes in general, whether superior or inferior group, they will drain into the jugular lymph trunk. Remember, the jugular lymph trunk that ultimately drains the entire head and neck. So this group of deep cervical lymph nodes, superior group drains to the inferior group, and both groups are draining either an outer circle or inner circle of lymph nodes, cervical lymph nodes. Supraclavicular lymph nodes are actually very important. This is to show you here how the supraclavicular lymph nodes are examined. The reason of their clinical importance is that they may enlarge in tumors that are located in the lung and some abdominal organs, for example, the stomach. So they might not only be enlarged because of a problem in the head and neck, which is the region that they naturally drain, but they might also be enlarged if there is a metastasis from a thoracic organ or an abdominal organ, especially on the left side. The reason for that is that these organs, like abdominal organs, for example, they will drain into the thoracic duct. And then here at this region, at the left venous angle, a backflow of lymph from the thoracic duct can pass into the nearby supraclavicular nodes that have just drained to the jugular lymph trunk. And so they will get involved because of this backflow of lymph. These lymph nodes, these enlarged lymph nodes, like for example here in this patient, 65-year-old man, presented with 6-month history of epigastric pain, weight loss, and nausea. He was diagnosed to have a cancer in the stomach, but you can see here how these lymph nodes are enlarged. And these lymph nodes, they have a special name of the person who described this enlargement because of metastasis from a gastric tumor. His name is Virchow. And the sign is called the Troisier sign, referring to the French pathologist. He described the clinical sign and expanded its link to multiple other cancers. As I said, like the mediastinal tumor might also result in this. So enlargement of supraclavicular lymph nodes because of backflow of lymph from the thoracic duct or from the right lymph duct that drains the right bronchomediastinal lymph trunk, backflow of lymph to the jugular lymph trunk and the inferior group of deep cervical lymph nodes represented by supraclavicular lymph nodes. As I said, that these deep cervical lymph nodes, the superior containing the Jugulo-Digastric, the inferior containing the Jugulo-Omohyoid, drain an outer circle and inner circle. But now let's deal with the outer circle or horizontal superficial ring of lymph nodes, which are palpable when infected as well. These are arranged in 6 main groups. The first group here is the submental group, which is, as the name indicates, it is located in the submental triangle, just beneath the chin and on the surface of the mylohyoid muscle. These submental lymph nodes drain a small wedge in the center of the face, including the chin, the lower lip, the tip of the tongue, and the anterior floor of the mouth. They drain to the submandibular group of lymph nodes, the next group of the outer circle. Some of these lymphatics will go directly to the Jugulo-Omohyoid node, a member of the inferior group of the deep cervical lymph nodes. Of course, submandibular lymph nodes are going ultimately to drain to the upper deep cervical lymph nodes and then will drain to the lower deep cervical lymph nodes. But as I said, that some of the submental nodes, remember they drain the tip of the tongue, they drain directly to the Jugulo-Omohyoid node, the lingual lymph node, as the nickname is the lingual lymph node. Now the second group of the outer circle are the submandibular nodes. They lie in the submandibular triangle. Remember, the submandibular triangle is bounded by the digastric muscle and the inferior border of the mandible. So they lie in close proximity to the submandibular salivary gland, not shown here. That's why they were primarily confused as glands before. So these submandibular lymph nodes, as I have just mentioned, they receive from the submental lymph nodes, but they also receive from a wider wedge on the face. So they receive from the cheek, from the nose, from the upper lip, the underlying paranasal sinuses, from the maxillary teeth, as we are going to mention that in a moment, from the gingiva, from the mucosa of the hard palate, the posterior floor of the mouth, and also from the tongue. So all these lymphatics will drain to the submandibular lymph nodes. Okay, I'm putting this oval area here so that you will not confuse that the submandibular lymph nodes are located inside the cavity of the mouth where the tongue is located. They are actually outside that. They are outside the mouth, not inside the mouth. They are located in the neck, not the mouth. But because this diagram is of a dissection that is also showing the mouth, I didn't want to confuse that. These are the submandibular lymph nodes. They are located in the neck, not in the mouth. And they are going to drain to the vertical chain of deep cervical lymph nodes along the internal jugular vein. Either they go to the upper group, or some of them they will go directly to the lower group. The third member of the outer circle of cervical lymph nodes is called the buccal and the mandibular nodes. And so the buccal nodes, they are located on the outer surface of the buccinator muscle in the cheek. And the mandibular nodes, they are like very small nodes present where the facial artery crosses the lower border of the mandible in front of the masseter muscle. These are called mandibular nodes. Both of them, the mandibular and the buccal, they receive lymph from the skin and mucous membrane of the cheek, the mucous membrane, the buccal mucosa, I mean, as well as the eyelids. And the lymph drains to the submandibular lymph nodes, as you can see here, but actually some of the lymph will drain to the parotid, or what we call the preauricular lymph nodes. So the parotid or the preauricular lymph nodes, they are the other member of this outer circle. They can be subdivided into superficial and deep parotid nodes. Superficial to the capsule of the parotid gland, and deep are located deep to the capsule of the parotid gland. The superficial parotid nodes, they receive afferents from the eyelids, from the orbits, the temple, from the prominence of the cheek, as well as from the auricle, and they drain to the deep parotid lymph nodes or to the deep cervical lymph nodes. The deep parotid nodes, as I said, they lie within the parotid gland, and they are in close proximity to the superficial temporal artery. They receive lymph from the middle ear, external auditory meatus, soft palate, posterior part of the nasal cavity, as well as the superficial parotid nodes, like we mentioned before. And the deep parotid nodes, they drain to the deep cervical nodes. They drain to the deep cervical nodes. not shown here because they are covered by the sternocleidomastoid muscle, and they lie along the internal jugular vein. Here, the sternocleidomastoid is removed, so they are the upper group of deep cervical nodes are located here. The other member of this outer circle are called the retroauricular or the mastoid. Retroauricular behind the auricle, and mastoid because they are related to the mastoid process of the temporal bone, and they receive drainage from the scalp, from the auricle as well. You can see here they are enlarged in this patient. They lie along the posterior auricular artery. All these arteries that I have just mentioned are branches of the external carotid artery, the facial artery, the superficial temporal, the posterior auricular artery, and they also drain to the deep cervical lymph nodes. The last member of the group of the superficial chain are called the occipital nodes. So they are called occipital because they lie at the apex of the posterior triangle in close proximity to the occipital artery, again another branch of the external carotid artery. You can see it here, the enlarged occipital lymph nodes, and they receive lymphatics also from the back of the scalp and drain to the deep cervical nodes. Remember, we mentioned that the deep cervical nodes drain from the outer circle as well as from the inner circle. So now we are done with the superficial ring, the horizontal superficial ring. Here again, this is the horizontal superficial ring, and you can see that ultimately they drain to the deep cervical nodes along the internal jugular vein. Now let's deal with the inner circle or horizontal deep ring, and these drain the visceral structures of the neck. They drain them outwardly to the vertical chain of the deep cervical nodes that are located along the internal jugular vein. The inner circle can be divided into retropharyngeal nodes and another group which is related to the trachea and the larynx, paratracheal, pretracheal, prelaryngeal, and infrahyoid nodes. And they drain the viscera of the neck. So the retropharyngeal nodes, they lie within the retropharyngeal space, which is between the posterior wall of the pharynx and the prevertebral fascia. And involvement of these retropharyngeal nodes might result in the spread of infection down to the superior and posterior mediastinum due to the facial relations in this region. They receive from the posterior part of the nasal cavity, from the nasopharynx, from the soft palate, middle ear, and the external auditory meatus. And you can see here that these retropharyngeal nodes, when they enlarge, they might cause difficulty in swallowing, in breathing, so they might result in obstructive sleep apnea. The other group of the inner circle of deep cervical nodes is the group containing the paratracheal, pretracheal. So we have the pretracheal in front of the trachea, paratracheal on either side of the trachea. Of course, we are talking about the cervical part of the trachea, the part that is located in the neck, not in the mediastinum. Of course, these lymph nodes will continue with the mediastinum and also will have a similar name. And then we have prelaryngeal lymph nodes, which are closely related to the cricothyroid membrane between the cricoid cartilage and the thyroid cartilage. And then we have infrahyoid lymph nodes located on the thyrohyoid membrane, which is located between the hyoid bone and the thyroid cartilage. These lymph nodes receive from the larynx, the trachea, the pharynx, and the esophagus. And as I said, that they drain to the deep cervical lymph nodes along the internal jugular vein. In the neck, there are also lymphoid follicles. They are called the tonsils here. They are not lymph nodes. They do not have a capsule of connective tissue, so they are non-encapsulated with a connective tissue capsule. They just lie underneath the mucous membrane. And these lymphoid follicles constitute a discontinuous ring called Waldeyer's ring of mucosa-associated lymphoid tissue molds. They are strategically located at around the entrance of the mouth and nose into the pharynx. So we have one of them is called the pharyngeal tonsil, located in the nasopharynx, tubal tonsil, again in the nasopharynx on either side at the opening of the auditory tube, pharyngeal opening of the auditory tube. And then we have the palatine tonsils, which are located in the oropharynx, and the lingual tonsil, which is located at the posterior third of the tongue. The name Waldeyer's ring is referring to the German anatomist of the 19th century and early 20th century. This is to show you the histology of a tonsil. Actually, it's a palatine tonsil. They are covered by mucous membrane in the form of non-keratinized stratified squamous epithelium. So there is epithelium here, multiple lymphatic nodules, and there are crypts. So the infectious agents will gain access to the tonsils from direct exposure on the surface or in the crypts. This is again to show you the tonsils. We have the paired tonsils, the palatine tonsils, which you can see in front of the mirror, or when you examine a patient with inflamed palatine tonsils. So tonsillitis in general refers to inflammation of the palatine tonsils. And remember that these palatine tonsils are the ones that drain to the jugulo-digastric node. That's why the jugulo-digastric node is called the tonsillar node. It's a member of the upper group of deep cervical nodes. And then another paired group, which is the tubal tonsil here. It is located in the nasopharynx and around the opening of the pharyngotympanic tube here. It's a little bit distended because the cartilage here is also distended, forming what we call the torus. And these nodes, they drain to the retropharyngeal lymph nodes. Here, see, this region here drains to the retropharyngeal nodes, the region of the nasopharynx. Then we have unpaired tonsils. These are the lingual tonsil on the posterior third of the tongue. Note that they give the posterior third of the tongue like a cobblestone appearance, and they drain to the jugulo-digastric lymph nodes. Then we have the pharyngeal tonsil, which is located along the roof and the posterior wall of the nasopharynx at this location, and they drain again to the retropharyngeal lymph nodes, like the tubal tonsils. These pharyngeal tonsils, they have a special name. They are called the adenoids, especially when they are enlarged. So the condition is called adenoiditis. Definitely, they will result in problems in breathing because they are located behind the nose in the nasopharynx. You can see it here in inflammation, especially chronic inflammation. It will cause narrowing of the nasopharynx. This is a lateral view. You can see the enlargement of the adenoid, narrowing of the nasopharynx. Patient in that case will become a mouth breather because of the narrowing of the nasopharynx. And if it is usually common in children, and children will have therefore more arching of the palate, and this will cause the permanent teeth to become crowded and irregular because of the higher arch of the palate. And usually the patient will have this facies, which is called adenoid facies, open mouth, mandible going down. And also note the close proximity of the pharyngeal tonsil to the auditory tube, the opening of the auditory tube. So infection here can easily, in that case, especially in children, can easily spread through the auditory tube to the middle ear, resulting in middle ear infection as well, otitis media. This is to show you inflammation of the palatine tonsils, tonsillitis. You can see that there are white yellow spots also. And this is to show you the enlargement of the adenoids in the roof and the lateral wall of the nasopharynx. This view is not a direct view. It can only be seen by an endoscope. Okay, so the endoscope is passing through one of the nasal cavities and extended into the back of the nose. But here, these can be directly seen by opening the mouth and depressing the tongue with a tongue depressor. Now let's deal with some areas of the face of special interest. So we have the lips. We probably mentioned that before, that the lower lip, they drain to the submental nodes. Some of them, they drain to the submandibular. But the upper lips, they drain to the submandibular lymph nodes. Regarding the gingiva, the vestibular gingiva that is located in the vestibule of the mouth, which is the region of the mouth that is located between the gum and the cheek. The other part of the mouth inside the tooth is called the mouth cavity proper. So this vestibular gingiva here, whether on the mandibular or the maxillary side, drain to the submandibular nodes. Remember that the submandibular nodes, they drain a wedge which is wider than the wedge drained by the submental nodes. And then on the mandibular side, the mandibular lingual gingiva and the mucosa of the mouth, they drain to the submandibular nodes or directly to the deep cervical chain. The anterior segment of the floor of the mouth, remember the small wedge, drains to the submental nodes. And then we have in the palate, the maxillary palatal gingiva and the palatal mucosa, they drain either to the submandibular lymph nodes or to the retropharyngeal lymph nodes together with the soft palate. Regarding the teeth, the maxillary teeth, they drain by vessels that pass to the face via the infraorbital canal and then pass inferiorly to enter the submandibular lymph nodes and the submandibular triangle. While the mandibular teeth, they will go along lymphatics backwards through the mandibular canal, not the infraorbital canal, the mandibular canal, here on the medial side of the ramus of the mandible, and end into the upper deep cervical nodes. Of course, you know that these submandibular lymph nodes are ultimately going to drain into the deep cervical lymph nodes as well. The lymphatic drainage of the tongue, the tip of the tongue drains to the submental nodes. The lateral aspect on the anterior two-thirds, they drain to the submandibular nodes. The medial portion of this part of the tongue, anterior two-thirds of the tongue, the medial part, drains directly to the deep cervical nodes. Then the posterior third of the tongue drains posteriorly to retropharyngeal group of lymph nodes. And we should always keep in mind that there is some crossing over the midline of the lymphatic drainage of the tongue.